You're going to be an even worse asshole when you're on testosterone. Welcome back to Gentle Giants Q&A. We're going to be doing part 2, talking about hormones, what you should know, okay? Once you start, you can never stop. You can stop, but there's a method to stopping correctly. Don't just stop cold turkey, because you're going to go from feeling amazing to depressed, okay? Trust me, I have seen it so many times, because you have patients who think they know more than I do, and then they come back saying, oh, I'm depressed, what do I do? Well, I told you that, but you know more than I do, so there you go. I think of testosterone, and how I explain it is it's just like giving your body something that's no longer producing, or not producing at an effective rate. B12, for instance, vitamin D, I see it every single day that people are deficient in these values that are so important for your well-being, immune function, and things like that. So what do? You give yourself vitamin D3 with K2, you give yourself B12, you give yourself vitamin C because your body's not producing it well. Testosterone is the same thing. It's naturally occurring in your body, but it's no longer being produced at the rate that it should. Therefore, you're symptomatic. So what do? We give yourself testosterone. And the myth that it says, oh, you die early, you have a heart attack with testosterone therapy, also a lie. My oldest patient is 92 years old, and I can tell you one thing, he does not play about his testosterone. He drives here with his son every 4 months from 5 hours away to get his hormones. So that myth about you die early, no, you die from all this other shit that y'all doing out here, not hormones. Think about all the alcohol and drugs y'all doing, you die from that, not something that's naturally occurring in your body. So get out of here with that mess. Hormone therapy, will it make you emotional or moody? So what I always tell patients is, if you already were an asshole to begin with, you're going to be an even worse asshole when you're on testosterone. But other than that, you're going to be the same peachy person when you're on therapy, so that it does not change your mood, other than improve it if you are depressed or anxious, because a lot of times that is the reason why people have these issues. So if you're out there taking all these Lexapros and all these SSRIs, get your blood work checked first to see if it's hormonal, rather than going on SSRI that causes you to gain weight, lowers your libido, so you worse than where you started. So think about that first, because doctors are quick to throw y'all on an antidepressant when that's not even a problem. You'll get bulky or masculine if you take testosterone. You only get bulky by what you eat. So if you eat in an extreme caloric surplus, then yeah, you're gonna get bulky, right? And if you eat a caloric deficit, then you're not going to. So everybody likes to blame testosterone for the reasons why their body changes as far as getting bulky or losing weight. It's what you eat at the end of the day. Quit blaming on all this other stuff. How about blame yourself for what you're eating and not moving enough? Plain and simple. Pellet therapy is dangerous and outdated. Pellet therapy is not dangerous. I know the product we use is made by yams and soy. And so it's plant-based. So it doesn't cause any issues there. However, one thing you need to know about pellet therapy is, because you're getting quite a bit of testosterone at once, your levels will go really, really high, but then it dips down over time. That's why for me, I'd rather give a person a troche or an injection, because they're gonna stay here the whole time, rather than going up here with pellets and then going down slowly over time. Because some people, if they do go really, really high in testosterone, they can have side effects, like some acne, or for women, they can see an enlarged clitoris, and that does scare them at first, right? But when you're doing a lower sustained dose of testosterone, those symptoms are slim to none. But pellet therapy does work. I know for me, I start low with patients, then go up, because you want to just see how they respond before going up. That's what any medication provider should be, starting at a lower dose and increasing it based off of follow-up and patient symptom report.